feel like there is a battle between control of your birth versus confidence in your birth. And which one is better? Today, I'm going to talk about what those two different things look like, how they feel different, and how they prepare you for your upcoming hospital birth. I'm so glad that you guys are here because I think this is really misunderstood, and I think you're going to get some great information here. And I want to tell you, this is something that I definitely saw in my 20 years in labor and delivery. People really wanted to be able to control their birth. And I am here to tell you that as a mom of a 25-year-old down, I also really want to control my kids. I want to control my life. There's so much about my life I want to control. Maybe you feel this way too, but there's a lot that we don't really have any control over. And that's the very, very annoying part of life. So let's talk about the difference.
Announcement. The pregnancy nurse is a nurse, but not your nurse. This is informational, not medical advice. Thank you.
And as a quick note, I see a lot of people thinking they get control when they create a birth plan. And I love birth plans, but it's not for that reason. I actually have a whole free birth plan mini series that I'm going to link to down below. It's really going to shift how you're looking at a birth plan and what it's really doing for you and your partner. That's right. I said partner because I think it's important to get them involved with the birth plan as well. Now, I am here to tell you that most social media and most people online want to help you control your birth, which as I look at birth classes that are available online, so many of them are like, you will get the birth that you're looking for if you take this class. And I'm here to tell you that there is literally no birth class you could take out there that will give you the birth that you want because it is not in your control. What you can control is feeling prepared for that birth, feeling confident for your birth. But I want you to notice when you're on social media, watching those short form videos, not here with the pregnancy nurse on YouTube where we give context and nuance, but when you're watching those videos, look at how many of them want to help you control your birth, control your postpartum life. And then I want you to remind yourself that while you can learn about it, there isn't a whole lot that you get to control about different areas of birth, pregnancy, postpartum, or honestly, life. So it can feel real good to watch those videos that act like you have control over this, but it can also feel worse when you realize you don't have any control over it. So something to watch for on social media. I've been watching for it lately, even with parenting advice or like gardening advice. There's a lot of garden. I garden. And there's a lot of advice about gardening out there that acts like you get to control what happens in your garden. But in reality, I have no idea what bug's going to come or how often I'm going to get out in my garden. I guess I control that, but I'm not going to be out there every minute. Anyway, we can't control everything, not even our gardens. Now, what you are looking for is to feel confident about your birth. And I want to share a little bit about what that looks like, because that's a really big word that you're like, I don't know what that's really going to be like, Hillary. So confidence is going to look like, instead of saying, I am not going to get an epidural, which is like trying to control it, it's going to say, I'd prefer not to get an epidural. You know your preferences. That's 100% fine. But I'm prepared in case I need to get one. I know the signs of if I need to get an epidural, and I'm prepared with information about the epidural should I need to get it. See how those two are different? One's trying to control and one's trying to be confident. And I actually have a whole video on like real life scenarios and how they go down with the epidural. I'm going to link it down below to give you more ideas about how people ended up being confident for an epidural. And I'm also here to say that the epidural is one of the trickiest things because you are in a ton of pain when we ask you if you want an epidural. And of course, the answer is yes. But most people don't even listen to that informed consent. They can't. They're in too much pain, which is why taking a birth class that goes over the epidural process, risks, benefits, what to expect from it can be really helpful because you're just not in that mind frame when you actually want the epidural and you meet the doctor who's going to be able to give it to you. Side note, I think it's really annoying that you can't get a consult with anesthesia before you go in for labor. I've heard of them in extreme circumstances, but most often they don't. Did anyone get a consult with anesthesia before they had their baby? Tell me in the comments if you did. Hi, squirrel. I love to get off topic. Okay. Back to confidence versus control. Okay, controlling, I'm not getting induced, right? I see so many people early on saying I'm not getting induced versus I would prefer not to get induced, but if I need an induction, I'm prepared with the questions that I need to ask them and some basic ideas about what an induction looks like. And I feel okay with that as an option if it needs to happen. Again, you're not controlling it. You're not saying I don't want an induction. And because I'm here to tell you, some inductions 100% save lives. They save babies' lives. They save moms' lives. They are a necessary thing. So just saying I'm not going to have one is not going to manifest the birth that you want. It's going to leave you troubled should you need to have an induction. Again, getting prepared, knowing what to expect. I actually have a whole induction series here on YouTube. I'm going to link that one down below, more about induction as well. But of course, if you want the real good stuff about inductions, there's a whole chapter in the online prenatal class for couples just about inductions that's really going to get you prepared about what to expect. And I got to say, so many inductions fail because of lack of education. Really important that you know about them because a lot of people are ending up needing to be induced. Now, I'm going to get a lot of hate for this one, but controlling it is my doctor's job to give me informed consent versus feeling confident. I know the questions to ask my doctor or midwife about after they give me that informed consent. So many people act like the doctor should be giving this ginormous informed consent with everything you could ever want to know about the procedure. And that's just not the case. An informed consent goes over the risks, the benefits, and the alternatives. It doesn't go through the whole procedure. It doesn't really go through what to expect. That's an additional thing that we should all be doing, discussing the plan of care. But an informed consent is really just some of the nitty-gritty and kind of the facts of the situation. And then you need to feel confident to ask the questions that matter to you. Am I going to be in the hospital long? Do you think this is going to be more painful? Could we wait? Right? That's a question that I feel like a lot of people don't end up asking, and it could improve their birth experience. Now, I'm here to tell you the absolute worst thing is that confidence doesn't generally come naturally. Now, every once in a while, I would get a patient who was really just naturally very confident in their own skin, but I'm not that patient. When I went in, when my appendix ruptured, I immediately felt myself get small and like I was a little kid in the bed, and I had to fight with all these tools and techniques that I have to get a full informed consent, to really know what we were talking about. So confidence doesn't come naturally. I really think that you need to learn from somebody about confidence and also confidence in labor because it's not something that we talk about all the time. Again, I recommend the online prenatal class for couples. I'm going to link it down below, but I really think it is the best way to feel confident versus social media, because in social media, you're going to get so many of those control videos that it ends up being difficult to really feel confident about things. And you don't get the nuance of situations, which breeds confidence. Nuance and context breed confidence. And a good birth class will give you all of that. Now, feeling like they have control over confidence is one of the mistakes that people make going into labor and delivery, but there are more mistakes that people make in labor and delivery. I'm going to link that video up above and down below. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared and confident for your upcoming hospital birth. But just know, you can't control it, which really sucks. I'd love to control more in my life.